pets can't tell us when they're in pain. We have to notice the signs. If you see your dog step on a bee and then he starts crying and limping, it's obvious that the paw hurts. But often animals instinctively mask injury and illness to protect themselves from predators or to lessen the chance that they get left behind by the rest of the protective herd. So it can be a real challenge to detect when they're in pain. On top of that, at one time in the not too distant past, veterinarians thought that pain was actually helpful for an injured or sick animal. It wasn't that they were being cruel or neglectful, but because veterinary small animal medicine evolved from veterinary large animal farm medicine. If a 1,200-pound horse injured a hoof, it was simply a practical matter that to keep a horse inactive to give the injury time to heal, letting the hoof ache a little bit would help keep the horse from running and re-injuring it. In the early years of my career, we would often perform abdominal surgeries like a Labrador dog spay without giving any pain medications because the dogs seemed to have a quiet recovery after anesthetic, and they'd actually be discharged from the hospital dragging their owners out the door hell-bent to get home. They sure didn't look painful. However, for every tough Labrador that was spayed, there were also the miniature poodles and the little Yorkies that seemed to curl up in the corner of the cage post-op and whimper, continuing to do so as they were discharged to their owners. Today, veterinary medicine has adopted just the opposite belief, that we should always treat for pain until there's proof that the animal isn't hurting. And this doesn't just apply to surgical pain, one of the most common types of acute pain. Other types of acute pain include the pain from injuries, from pets that are hit by cars, suffer bite wounds, have a ruptured spinal disc, have deep organ pain like with pancreatitis, suffer a burn or a chemical injury, or have dental pain from an infected tooth root, and so on. We are also very concerned about the other type of pain, chronic pain, like the constant pain associated with cancer in bones or organs, intractable spinal pain that doesn't respond to early treatment, the painful eye due to developing glaucoma, or the cat who has severe inflammation of the oral mucosa and the gingiva around every tooth, and so on. These can be much more of a challenge to diagnose, as most pets, as we have said, will always put on their best happy face and tail wag for their owners, even eating crunchy food and playing tug of war with a mouthful of infected and abscessed teeth. So how do the veterinarian and the owner know when their pet is in pain? On the veterinary side, many pain research studies have been conducted and have led to the creation of a very effective pain scale that all veterinarians now use to positively identify a pet in pain. It is modeled after the pain scale pediatricians use for infants and toddlers who also can't communicate where the pain is. For pet owners, other than noticing true crying out, lameness, or the more obvious signs that we would all recognize, you must assess your pet's behavior to know if he's in pain. Look for any of the following signs that might be your pet's way of saying, "I'm hurting." If your pet is being unusually quiet, listless, or unresponsive, I'd be concerned about the possibility of pain. If he's whining, whimpering, howling, constantly meowing, or even biting the owner, that's a concern too. If he's constantly licking or chewing in a certain part of the body, it may pinpoint the area that's sore. If he's acting funny, out of character, being either aggressive or even submissive, that's a key sign as well. If his ears are flattened against his head, if he's having trouble eating or sleeping, you should contact your veterinarian. Seeking a lot more affection than usual can also be an unusual sign that would lead a person to believe he might have a problem. If your pet's unable to get comfortable by changing position constantly or pacing and refusing to lay down, that's also a possible sign of pain. If you suspect your pet might be hurting, consult your veterinarian and be prepared through careful observation to discuss your pet's behavior, activity level, and tolerance to being handled. We will help you figure out the problem and discuss the specific options for controlling that specific type of pain. Until your pet can be examined by your veterinarian, there are some simple things you can do at home to help keep your pet comfortable and to monitor whether her pain level is changing. Massaging your pet from head to tail, being careful to avoid the painful areas, may also help to relax and soothe him. Putting his bed on a rigid stretcher-like board to prevent sudden shifts in position and to use to get him into the car is a wise move also. So, what are the different types of pain medications prescribed every day in veterinary medicine, and when are they most effective? There are currently many classes of pain medications available, and aside from pill forms, many drugs come in liquid form, transdermal gels, or even skin patches. Some can be compounded into chewable treats. For orthopedic pain like ligament tears or osteoarthritis, and similar types of pain that are inflammatory in origin, including the inflammation of recent surgery, the most commonly prescribed drugs are the non-steroidal anti-inflammatory drugs that are similar to prescription and over-the-counter human medications like ibuprofen, Aleve, Celebrex, and many others. The medication used in pets have been thoroughly tested to ensure they don't routinely cause severe side effects like gastrointestinal ulcers, so do not use any human anti-inflammatories, including ibuprofen, Aleve, aspirin, or Tylenol. In one study, 100% of dogs taking Aleve and 50% of dogs taking ibuprofen developed stomach or intestinal ulcerations. Tylenol can be toxic to both dogs and cats. Some of the brand names of non-steroidal anti-inflammatory drugs used in pets include Rimadyl, Daramax, Zubrin, Metacam, and several others. Now, on the other hand, for deep organ pain, general trauma, intestinal pain, fractures, severe infections, and many other painful conditions, there's absolutely no substitute for narcotic pain control. Medications like buprenorphine, morphine, butorphanol, and other related drugs are always indicated for severe, acute pain. For chronic pain, skin patches containing fentanyl or tablet forms of narcotic-like medications such as tramadol are often used. Neuropathic pain, like that from an injured nerve or from chronic spinal compression, will often respond to gabapentin, a neurotransmitter-like drug that is also used to control seizures. Sometimes we will combine medications to heighten pain relief, like adding a narcotic to an anti-inflammatory medication, or combining a narcotic with an antidepressant medication that actually has been found to allow us to use a lower dose of the narcotic to get the same degree of pain control. When talking about combining medications, I do have to caution pet owners to never give two anti-inflammatory drugs together. For example, don't use Rimadyl and aspirin together, or Daramax and prednisone, as this can lead to severe GI ulceration. And you should know that when two different narcotics are given at the same time, they don't give you a heightened effect. They can actually cancel out any analgesic effect from either drug. So always consult your veterinarian for medication advice. Today, alternative medical therapies like acupuncture have been shown to often be effective in controlling pain, as well as for other indications. Veterinary certified acupuncturists are becoming common across the country. We have a veterinarian performing acupuncture in our practice. When alternative therapies are successfully combined with traditional medical therapies, this is termed integrative therapy and is becoming very popular in veterinary medicine. No one knows your pet better than you, so partner with your veterinary staff to provide your pet with a pain-free life. Please call our office to discuss any pain-related issues with our veterinary staff. And this has been another pet health tip from the staff of the Pittsburgh Spay Vaccination Clinic, a full-service veterinary facility.